The normal blood flow of the heart comes from the body and through the superior and inferior vena cavas into the right atrium. The blood then goes through the tricuspid valve into the right ventricle and out the pulmonary artery to the lungs, where the blood then gets oxygenated and comes through the pulmonary veins into the left atrium. It then goes through the mitral valve into the left ventricle, and then through the aortic valve into the aorta and out to the body. Angina is chest pain, like squeezing pressure or heaviness, due to reduced blood flow from the heart. It is a primary symptom of coronary artery disease. This is when atherosclerosis, or the buildup of plaque, occurs in artery walls that support the heart. This can block blood flow to the heart muscle and increase a patient's risk for heart attack or heart failure. Atherosclerosis is the gradual buildup of plaque in artery walls. This is caused from damage to the inner artery wall and causes artery stiffness and plaque development. The plaque can completely block an artery, causing total occlusion that may lead to a heart attack or stroke. Myocardial infarction, otherwise known as a heart attack, occurs when blood and oxygen supply to the heart is reduced and part of the heart suddenly dies. It is usually caused by atherosclerosis, but can also be caused by blood clots that can get trapped in arteries. Myocardial infarction can cause chest and arm pain and increased heart rate, sweating, fatigue, and nausea. Aortic valve stenosis is a heart condition that occurs when the aortic valve narrows and obstructs blood flow across the valve. This is often caused by calcification due to age, and patients may have little to no symptoms, as it takes many years to develop. Patients with severe AS can experience chest pain, dizziness, and congestive heart failure. PFO is an abnormal hole in the wall between two atria of the heart. It is a congenital condition, meaning it is present at birth. It is usually asymptomatic and harmless, and around 25% of the population have it. In rare instances, it can cause strokes, migraines, and heart attacks. Congestive heart failure is a disorder where your heart cannot pump enough blood to support your body. It is caused by a variety of things like heart attacks and cardiomyopathy. It causes ventricle walls to be thin and weak, and the blood that should be in the body remains in the ventricle. People with high blood pressure, coronary artery disease, metabolic syndrome, diabetes, and structural anomalies may be at high risk.